morning.
And this will as well. If an elderly person's memory starts slipping, what do? How can you make sure that vital information, like a list of critical medications, is readily available? How about a high-tech chip? Even if that chip is something you'd normally find on pets, not humans. It's a debate sparked by a real-life experiment about to get underway, and John Berman has more.
For the families of Alzheimer's patients, it is a nightmare scenario. Their loved one gets separated or lost, ends up in a hospital with no way to tell doctors who they are or what is wrong with them. It happened to Emerson Moran's wife, Pat.
Pat was not able to tell them where it hurt, what was going on with her. She couldn't give them information about her meds or medical history.
That's why this Alzheimer's center in Florida is launching a trial program to implant 200 patients with this tiny microchip.
It gets injected like having a shot of medicine in the upper right arm area by the tricep. The chip itself lies dormant. There's no power source, there's no battery, there's no energy, so nothing's going on underneath the skin.
The chip has a 16-digit identification number. It can get scanned at a hospital, and when the number is put into a database, it can provide crucial medical information.
Having this type of ID and having this type of technology to get the kind of assistance that they need right away is life-saving, because our patients are so fragile and vulnerable.
It is the same type of chip that has been implanted in pets to help identify them when they are lost. But critics argue that humans are not pets, and privacy groups staged a vigil outside the Alzheimer's Center to protest what they see as Big Brother branding.
This is a very invasive procedure, and unless someone can give full consent, then it's really a violation of their body and their bodily integrity.
Emerson Moran says the protesters should butt out.
If it's your wife or if it's your mother, you want that information available to the right people.
Now, critics say that bracelets might be a better option, but the problem with bracelets is patients can sometimes rip them off. Now, this microchip, which you can see is only the size of a grain of rice, clearly a patient can't rip that off.
For the 20 million Americans who live with diabetes, daily finger pricks are a painful part of life. Getting the proper glucose reading is critical in controlling your diabetes. There is now a group of biotech companies that say they can change the way diabetics monitor their blood sugars with an implantable microchip like this one.
We're here in New York to unveil to the world the plans for the development of an implantable glucose sensor using RFID, or radio frequency identification technology. A tiny microchip about the size of a grain of rice would be injected into the arm of a diabetic patient, where they could actually take their glucose reading from within the body on an external scanner, thereby negating the need to prick your finger 1 to 4 times a day.
Microchip Corporation has been a pioneer in RFID technology, first with their pet ID applications, and most recently in humans with their VeriMed patient identification system. They're now working with a biosensor development company, Receptors LLC, in hopes to develop a working prototype for the implantable glucose sensor over the next 6 months.
People have been trying to develop in vivo, in the body, glucose sensing technology for, I would say, roughly 30 years. And the projects have always failed because they haven't used an integrated approach. And that's one of the real strengths to this project.
It is anticipated that after this microchip is placed, the patient can painlessly monitor their blood sugars using a wireless scanner. The scanner also powers the microchip, avoiding the need for an internal battery. This easy, pain-free technology hopes to change the lives of millions of diabetics.
Well, I think the goal would be for a diabetic not to even remember that they're a diabetic, that it becomes so transparent what they need to do that it's just not a big deal to them anymore. Whereas right now, they really have to factor that into their lives.
But these efforts are just the beginning. The companies hope to have this chip tested, FDA approved, and in the market within 3 years. Diabetics can expect the sensor to last in their body for up to 6 months before a replacement is needed. I'm Dr. Manny, Fox News.
With the VeriMed system, if you know up front what someone's advanced directives are, it will guide your therapy to be most appropriate for those patients' wishes and the family's wishes.
I feel that joining the VeraMed Physician Network gives a lot of benefits to my patients. Certainly, I see a lot of elderly patients, and they have a lot of comorbid conditions and certainly are at increased risk of possibly presenting to the emergency room, and possibly presenting to the emergency room either comatose or confused or unable to give out information that would be vital at the time that the emergency room physicians would need to know exactly what their diagnoses are, what their medications are, what their advanced directives may be, any of their allergies.